Okay, well, since it's noon, we'll get started. Good afternoon, everybody. My name is Jennifer Potter, and I'll be your moderator today. Today, we're going to be talking about radiation treatment, and we are pleased to have Elizabeth Bullard with us. She is a clinical nurse researcher with the Department of Radiation Oncology here at UNC, and she'll be talking to us today about how radiation treatment works, some of its side effects, and what patients can do to prepare themselves for such treatment. I want to call your attention to the email address and phone number on your screen right now. If you're experiencing any technical difficulties, feel free to use that phone number. You could also use the chat feature at the bottom of your screen in Zoom, and one of us will be able to help you navigate your issues. Throughout the presentation, you'll see the email address in the bottom left-hand corner, and that's for any questions you might have about the content that Elizabeth will be presenting today. We'll have time at the end to answer some of your questions, so please feel free to use that feature. And Elizabeth, if you're ready, without further ado, I'll turn it over to you.
Can you guys hear me?
Uh-huh.
All right, perfect. So I will start with our first intro slide. Everything I'm going to be talking to you today about is regarding preparing for your radiation treatment. And that photo is of the UNC Cancer Hospital. So one of the first questions people have whenever they're seen in the radiation oncology department is what exactly is radiation? And if you've ever had a dental x-ray or an x-ray in the past, you have had a form of radiation used on your body. Would that same radiation that would be used in an x-ray is increased to a high enough dose, it can be used to kill cancer cells. It can kill cancer cells, it can also slow the ability for cancer cells to spread throughout the body. So it is one of the most commonly used therapeutic modalities for treating cancer. And that image at the bottom of the slide is just showing what an example of a radiation machine would look like for a patient. So it is mostly open space, and for most patients, they are not going to be experiencing the same type of closed-in features of an MRI machine. The example that I pulled for this photo is showing one of the most encapsulated radiation machines. So any other type of machine that would be used is actually going to be much more open than this one. This is the most closed a machine that would be potentially used. And how is radiation therapy given? There's two most common avenues of receiving radiation. One is externally through a machine, and one is internally, where small seeds might be implanted or a cylinder or device is placed internally, and then radiation is delivered directly to the source, and the source being a tumor or collection of when you hear somebody talking about having received radiation, almost always it's an external beam radiation. So that is the most common form. It is possible for certain malignancies to receive a combination of external and internal beam radiation, and a good example of a patient population who might get both is patients who have prostate cancer. So then who does tend to get radiation therapy? Over half of patients who are diagnosed with cancer do receive some form of radiation therapy, so about 60%. Radiation can also be used alone or in combination with other therapies. So like I said earlier, radiation is going to be hopefully killing the cancer cells and also slowing growth. So in certain situations, if cure is not a realistic goal for the patient, radiation can be used to shrink the size of a tumor, which could alleviate pain and make the patient much more comfortable. So it can be used palliatively, but it can also be used curatively. One of the most common questions that providers and nurses receive from patients is, how do I know that my radiation is working? Whenever people are coming in for treatment, they'll always be like, is it working? Is it working? Is that my tumor going away? And radiation does take some time to work, which can be a little frustrating for a patient who's hoping to get updates and knowing at the end of their treatment that it's all better, the tumor is gone. So radiation is going to be delivered to the targeted area that we're hoping to shrink or kill cancer cells in. And the treatment length or the course of treatment can be a combination, like it can be a couple of days, it can be weeks, it can be many, many weeks, like upwards of 10 weeks. And the radiation is going to be active inside of the body, or the effects of the radiation would be the better terminology. The effects of the radiation are going to be acting within your body even after your treatment is over. So most patients are going to have a follow-up appointment whenever they have completed their radiation within 3 months. And at that 3-month follow-up is when we are able to deliver results in terms of how effective the radiation was or how well it did work. If there's side effects or symptoms that require you to be seen sooner than 3 months, that is something that can certainly be accommodated, but in terms of understanding how the radiation, how effective it might have been, that would be about 3 months after you've finished treatment. So then what does radiation therapy do to healthy cells? So the goal for radiation is to minimize any radiation being delivered to healthy cells. A lot of time is taken by your doctor, there's a physicist involved and a dosimetrist who are going to help build a specific radiation plan for each patient. So plans are not recycled, they're individualized for each unique individual person. And all of the effort in the world is concentrated on trying to make sure your radiation is going to the malignancy site or the tumor and not impacting the surrounding healthy tissue. So your entire body is not receiving radiation, it is focused and targeted at the site that we're hoping to affect the most change. Unfortunately, there's going to be a little bit of scatter to the side of the malignancy or tumor, so you're going to see some side effects to healthy cells, but radiation is especially effective at killing cancer cells, and healthy cells are able to improve significantly once radiation treatment has stopped. We'll speak more to healthy cell damage in a further slide that talks about side effects. So how your doctor is planning on protecting healthy cells is to find the perfect dose balance for you specifically. So your dose is going to be decided by finding the highest dose that you will need to kill your cancer with the lowest dose to be effective. So giving you an incredibly high dose of radiation would not be beneficial if we end up like damaging your entire body or killing a bunch of healthy cells in the process. So finding the perfect dose is something that's calculated by the physician team, making sure that you're getting enough to kill the cancer, but not too much to cause unnecessary damage. Another option in terms of delivering this higher dose in a way that protects healthy cells is splitting it up over time. Oftentimes, your radiation team will discuss that the process of radiation and receiving treatment every day is kind of like having a big pie, and each treatment is a little slice of the pie, and at your final treatment, you've received your entire dose or you've had the full pie. So rather than picking a dose goal for the patient and then just delivering it all at once, we pick a goal dose and then spread out the treatments over time to keep healthy cells safe. So healthy cells have enough time to repair themselves, but not too much time that a cancer cell could start repairing itself. And another common question people ask is if you can feel radiation or if it is painful to receive radiation. It is not. So a patient who is laying on a table receiving radiation is not going to feel it. They'll be able to hear a machine moving around them, and if their eyes are open, they might see the movement of the machine, of course, but you're not going to feel the radiation on your skin or impacting a part of your body. The thing that can be painful, depending on the treatment site and the duration of treatment, is the side effects. So anybody who is receiving radiation treatment is going to be scheduled to see their medical team, so their physician, their nurse, to help manage symptoms and side effects that are accumulating over time with radiation. But in the moment of receiving treatment, you will not be able to feel it. So radiation can be combined with different treatments, and one of those is surgery. And there's 3 main ways that we utilize radiation in combination with surgery. One is to have your radiation before your surgery. If there is a large tumor, it might be beneficial to perform radiation before the surgery to shrink the tumor and make it easier for the surgeon to remove, and also easier on the patient in terms of recovery time and structures around the tumor that might be affected. It's also an option to have radiation during surgery. It's called intraoperative radiation. And whenever the patient is open in the surgical environment in the OR, then a little bit of radiation can be targeted directly to the source of the tumor or the cancer cells. So that is something that would not be a daily occurrence. That is a procedure that would happen once during surgery. And then another common modality is to have radiation after surgery. So oftentimes patients who are seen in the radiation clinic are like, well, I'm scheduled for surgery that's going to remove my tumor, so why would I need radiation? Radiation after surgery is to make sure that if there's any small amount, microscopic cells that were left behind and the surgeon could not see, or the margins might not have been cleaned from surgery, that radiation can come in and remove the rest of the cancerous or malignant cells. Radiation can also be used in combination with chemotherapy. Oftentimes, radiation is considered sensitizing for chemotherapy, so it can make the chemotherapy more efficient and effective for treating the overall cancer. Radiation can also be used after chemotherapy to kill any remaining unhealthy cells that might have not been killed by the chemotherapy initially. And then who is on your radiation team? So whenever you come to the hospital or your radiation outpatient clinic and you meet the team of people who are going to be working with you, it's a significant amount of people. So number one, of course, is your radiation oncologist. You might have additional doctors who are involved in your care, but specifically when it comes to determining your radiation dose, how much time you're going to be receiving treatment for, exactly how we're going to deliver the treatment. Is it external? Is it internal? Is it before or after surgery? These are all determined by your radiation oncologist. Your radiation oncologist is also going to be helpful with ordering medications for you, but the majority of what they're focused on is your treatment plan and making sure that everything in terms of your radiation dose and delivery is ideal for you. These are some of the radiation physicians that we have at UNC main campus. If you are at a Hillsborough location, a few of these providers do tend to cover the Hillsborough location occasionally, but these are providers that you would see if you're coming to UNC main campus. They represent a variety of locations physically in the body, so we have head and neck specialists up on this slide, breast and gynecology, as well as prostate and bladder. And this is not an exhaustive slide of all of our radiation oncology providers, but it's a few faces that if you've had radiation treatment, you might recognize, or if you're anticipating radiation treatment, you might meet some of these providers in the future. So one of the next team members is the nurse practitioner. The nurse practitioner is an advanced educated nurse, so they have gone back to school after receiving their nursing degree to get additional education. And they support the medical team. They're also going to be very involved with your symptom management while you're on treatment. So oftentimes ordering tests for you, if you're dehydrated, ordering you fluids, adding on medications to manage your side effects, even helping with some of the paperwork that's needed to help support you if you're taking time off of work. The nurse practitioner is going to be working extremely closely with the provider, your radiation oncologist, as well as the nurse who's assigned to your case. And these are our nurse practitioners. We have 2 nurse practitioners listed on this slide and 1 physician assistant who functionally is the same. So they are all specialized at the UNC main campus radiation oncology outpatient clinic. The next member is the radiation nurse. So a radiation nurse is an outpatient nurse who has taken time to learn how to help support oncology patients with their symptoms and side effects specific to radiation. They're going to be working with you closely during what we call your status checks or your weekly doctor's appointments when you're on treatment, noting your vital signs, your weight, your symptoms, communicating those to the medical team and working closely to support you throughout treatment. They're also very integral to education and managing questions and preparing you for the entire process of radiation, because it can be quite a lengthy journey from start to finish depending on how many weeks you are receiving treatment. And these are some of the main campus radiation oncology nurses that you may have met or might meet in the future. One of our nurses who's in the top left corner specializes in internal radiation or brachytherapy. You're also going to have a radiation therapist. You will see your radiation therapist every day. They work at setting you up on the table, getting you prepared and in your proper position for treatment, and then they run the machine that delivers your actual radiation treatment. And they make sure that you're receiving the exact prescribed dose that your physician team built for you. And these are some of the UNC main campus and UNC Hillsborough campus radiation therapists. There are other people who are part of the radiation team who will definitely be supporting you through your journey. So nutrition is always going to consult with our patients and make any sort of specific dietary requests or plans as needed. As some patients become more symptomatic, they might need support with Ensure or softer foods. And so that's something that nutrition is a huge driver of. And then physical therapy as needed, also occupational therapy. Social work can help with a lot of different options for our patients who are living hours away from UNC main campus and may have a specific need in terms of brachytherapy that could not be done at a local setting. So social work will oftentimes help with getting assistance to stay locally for a patient and their caregiver for a number of weeks. And then speech and swallow therapy is another support for patients who particularly have received radiation to the head and the neck and might be more symptomatic in terms of swallowing. So we're able to work with them closely to make sure that you are safe. Special diets during radiation are certainly possible. So to expand more on nutrition, your team is going to make sure that you have a diet that will agree with your treatment protocol. One of the things to consider is that most patients who receive radiation for a number of weeks, they're going to lose weight because of what's happening at the cellular level in their body burns a lot of calories. So making sure that you are eating a well-balanced diet and hitting 2,000 plus calories per day is very important. And your nursing team, your medical team, and the nutritionist will work closely to make sure you're not losing too much weight and that you're receiving enough protein in your diet. Protein is going to be critical to helping your body to heal during the radiation process and the recovery process. So nutrition is certainly important. A lot of questions that patients present to outpatient radiation oncology clinics with is, can I work during treatment? There's no broad answer here, so depending on where you're being treated in your body specifically, you may find that it is quite easy to report to work regularly. You might find that you're becoming very symptomatic and it is difficult to report to work. The things to consider are that it's certainly different for every person based upon their treatment course. You're also going to be expected to report to the hospital for treatment Monday through Friday. For some patients, they even have to come twice per day. So they may feel well enough to work, but have a struggle of just being able to physically get to work based upon whatever time they have to report for treatment and the fact that it is so frequent. Another thing that is considerable is that you might start your treatment and feel well enough to work, and then as the treatment progresses, become quite tired and fatigued and may need to consider the option of taking some time off of work. So our department works very closely with each patient to make sure that if you need paperwork or FMLA, anything that needs to be filled out and submitted to support you through this process, we're there for you and we'll make sure you have what you need. We do try and ask people to not push themselves too hard when it comes to trying to work, so that they are allowing themselves the time to heal and to rest as needed. So just something to consider. And then this is just kind of what I had already said, but radiation treatments are Monday through Friday. So you would be off for the Saturday and Sunday. You would not receive treatment. And there's a couple of floating holidays. So Christmas Day, we're closed. Thanksgiving Day is closed. And Memorial Day, we're closed. So that's an upcoming holiday. But that additional day off of treatment is not going to affect the outcomes in terms of how your treatment will be received. So just keeping in mind the frequency of how often you're having to come to the hospital is very important. So once you're done with treatment, what happens next? So from your start point of treatment to your final point of treatment, you're seen at least one time per week by your medical team in the radiation oncology clinic. So we're making sure that you're supported throughout your process with answering any questions you might have, managing your symptoms and side effects. But after treatment, we try to make sure that we see you fairly soon after you finish treatment to make sure any residual side effects that might need managing, any medications that you might need, you have. One of the final things that we try and encourage you to do at your final status check is we'll set you up for your next appointment in terms of follow-up so you know when you're going to be seeing us again. Make sure you have all the contact information if you do have a question and you have a question before your final your follow-up appointment. We do encourage that you reach out through Epic InBasket if you have questions. And we also make sure that any medication we've prescribed for you for a symptom or a side effect is refilled so you're not at risk of running out before your follow-up appointment. And then post-radiation symptoms. So typically the most symptomatic a patient will be during radiation is in their final week of radiation and the couple of weeks after that point. So before we release you from your radiation treatment and you go into the follow-up phase, we do make sure that we have a clear understanding of where you are symptomatically, supporting you through every side effect and symptom that you might have, making sure that you've seen the nutritionist for a final meeting or you've met with the speech and swallow therapist if you have needs with swallowing and eating. Those are all things to discuss. We make sure that you have support with nausea, with pain. If there's any kinds of swelling or lymphedema, we do consider sending you home with some supplies to wrap that area if there's some significant swelling that's impacting functionality. And then we just start laying the groundwork for our follow-up care plan for you when you return for your follow-up appointment. So what is external beam radiation? Kind of transitioning to what exactly has your body received or what is your body going to receive? And this is circling back to that first slide where it was the external beam versus the internal radiation. So when somebody says they've received radiation, almost always this is the type that they have received. And again, I pick the photo of a radiation machine that is the most closed in. So anybody who might have fear or claustrophobia, this is the worst case scenario in terms of a machine that you would be using. And it's open on both ends with a sort of like donut shape around the middle. So your head is not going to be backed up into an endpoint. It's all open around you. And this is the most enclosed of the machines that's offered at UNC. The machine can be a little noisy. Most of the rooms that patients receive treatment in, the radiation therapist will play music for you, and it's also very cool, so just bear that in mind. If you are cold-natured, you might want to dress in layers. And the machine is moving around you so that it's focused exactly at the treatment site as opposed to just generally sending out radiation. So this is a very specific, targeted endeavor. And again, with the frequency of radiation, it's 1 time per day. Typically, it can be twice per day. You get smaller doses twice per day. And that, again, is to be most effective in killing your cancer cells and protecting your healthy cells. And it's 5 days per week unless there is a holiday, and it can range from anywhere, a minimum of about 2 weeks to 10 weeks. And depending on where you are being treated, you would most likely be treated in an outpatient setting unless you're receiving the intraoperative radiation, which you would certainly be in an OR for that. But for the most frequently used types of radiation, it's an outpatient setting, which might be housed at a hospital, but you are not an inpatient for this. And the treatment time on the table is typically around 15 to 20 minutes, but I would allow an hour for your whole entire visit, so that you have the time of check-in, of any kind of changing of clothes, positioning on the table, any questions you might have after your treatment, and then changing back into clothes so that you can leave. Before you start your radiation, your first appointment will be your new consult where you meet the medical team that we discussed, so your radiation oncologist. There will be a medical resident who is specializing in radiation oncology. You might meet a nurse practitioner or physician assistant, and you'll definitely meet your nurse. You will not meet your radiation therapist until you actually start your treatment. And the goal of the new consult is to lay the groundwork for understanding what specific type of treatment works best for you and your family, and making sure that we have a good understanding of your baseline symptoms and side effects already so that we can anticipate your needs throughout treatment. It's also possible that you may need some imagery performed before treatment starts so that we can get a good baseline for where you are before treatment, and then we would do repeat imagery when you're done with treatment. Before you're able to start radiation, there is a simulation appointment that you have to attend, and this is essentially a planning appointment. So you've met your team, they bring you back in after your new consult, they set you up to have a CT scan done, and then the radiation therapists will help with positioning your body, because at your simulation appointment, whatever position the plan is made for you in is the position that you will be in for every treatment that you have, for however many weeks you receive treatment. A number of times patients are going to be given these very small pinprick tattoos. The device is not a tattoo gun. It is actually very similar to if you've ever had your blood sugar taken and there's just a little finger stick. It deposits just a little bit of dye, and those dots are used to line you up for your treatment and all subsequent treatments that you receive, so that we are replicating the same physical position for each treatment. Everything that you're getting is completely replicated from time to time, and there is no deviation from the plan that is simulated and set forth for you. These little tattoos are small, but they are permanent, and they will be about the size of a freckle. Another thing that will be built for you potentially at your the simulation appointment is a body mask or a mold. The body masks are going to be used for people who are receiving radiation to their brain or to structures of the head and the neck. The head and neck moves incredibly, it's incredibly easy to move your head and neck, and so the mask is necessary to keep the head stabilized for treatment. It is a soft plastic that is bathed in a warm water bath and then stretched over the patient's face. It is breathable, it is very thin, it is only used on that specific patient, and if need be, sometimes we can cut out a larger mouth area or nose area if there's any kinds of swelling or concerns in terms of claustrophobia. There's also an option for patients that have claustrophobia to potentially receive a pre-medication. We have had a number of success stories of patients who were very fearful of the mask and ended up using a combination of meditation and breathing practices to bypass needing essentially like a medication to support them through this treatment. But the mask is unique to the head and the neck structures and brain. And then for a body mold, they're typically made out of plastic or a plaster form. Some of the plastic molds have some air or like a beanbag almost structure inserted into them, so they are sculpted around your body. It's frequently used for breast cancers, for lung cancers, sometimes for cancers of the abdomen, and it's again to make sure that you are in the same position for every single treatment that you receive. And these are images of what a face mask looks like and what the body molds look like. The face mask is a very, very thin, flexible plastic, and it is breathable. So one of the other questions that a lot of patients ask is what they should wear for treatment. Depending on your treatment site, you might need to switch into a hospital gown. So a lot of the times for patients who are being treated for breast cancer, they will need to wear a hospital gown. So clothing that is easy for you to change in and out of is very helpful. Avoiding tight-fitting, really restrictive fabrics is a nice idea too, because you might have some swelling over time and that tightness could be uncomfortable. And also dressing in layers, as it can be a little bit chilly in some of these rooms. And then whenever you're showing up for your daily treatment, what do you do? So depending on what UNC outpatient setting you're in, it could be subtly different, but for UNC main campus, you are going to park in a small parking lot that is outside of the radiation oncology department. You will have free parking at the main campus whenever you're actively on treatment. You'll check into the radiation oncology clinic with a little scan card that kind of looks like a credit card, and that scan will allow your treatment machine to know that you're here and you're waiting and ready for treatment. You may need to change into a gown, which can be done so in our men and women's dressing rooms. And then once you are brought back for your treatment, your therapist will come and get you, take you to your treatment room, lay you down on a table. If there's a mask or a body mold, make sure that you're using that appropriately. Take some time to carefully line you up and make sure you're in the position that your simulation plan picked for you, and then deliver your treatment. During your treatment, you might see some colored lights. Those are lasers that are harmless, and the therapist is using those to line your body up with those little like the tattoos that were done in your simulation, they'll use lasers to make sure that they're lining up your body as agreed upon. But the laser is not radiation. You can't see the radiation at all. And despite having a face mask or any type of a body mold, we just try and make sure that everyone knows to stay as still as possible during their treatment, as that is very helpful. And because radiation is being delivered, the radiation therapist will be outside of the treatment room and watching you on a closed circuit camera and is able to talk to you. And if there's any need to stop treatment, if you feel you're going to be ill, if you cannot hold the position or some other reason like that, you can speak during your treatment. The radiation therapist can stop the machine, come in, help support you, either get a nurse to give you a medication or reposition you if that's needed, and then restart your treatment. For specific to patients who are receiving external beam radiation, a lot of people will be like, am I radioactive? And no. So for external beam radiation, you are not going to be radioactive. There's no groups of people that you need to avoid being around immediately after your treatment at all. For patients who are receiving internal radiation with radioactive seeds, for a period of time, they will need to avoid sexual intercourse, being too close to small children, or having a pregnant woman sit in your lap. So there's small exceptions to the rule for people who have internal radiation, but that is not a permanent forever radioactivity. It's for a defined period of time, and your provider will work with you and let you know how long that is. It's typically around 6 to 9 months though. So then again, speaking to internal radiation, internal radiation allows us to deliver a high level of radiation in a very, very small potent form to a specific area in the body by placing it there directly. So it's frequently used for prostates. So if you've heard of someone receiving prostate brachytherapy, then they have had seeds implanted to treat their prostate cancer. And that is one of the treatments where you would have some restrictions for a period of time, but it's not permanent. And then I love this photo because it shows 3 prostate seeds laying on a penny, so they're incredibly small. A lot of people, when they think of radiation being implanted into their body, that's such a foreign concept and it can be scary, of course. So being able to see just how small these seeds are is very helpful. And they are typically made of gold. And even though the seed will not always be containing radiation, it will not always be radioactive, the seeds typically will always stay inside of your body once they are placed there. Then talking about radiation side effects, one of the things to note about side effects in general is that at your first treatment on day 1, you're not going to suddenly start having all of these side effects. You may have some combination of these side effects. The side effects are going to be specific to whatever part of your body is being treated. So if you're being treated to the head and the neck, I would not expect you to have pain at your knee. I would expect you to have dry mouth, maybe some difficulty with swallowing. The inside of your mouth might become quite sore. Contrasting, if you got radiation to your breast, I would expect maybe some swelling, definitely some skin changes over time. But again, the thing to consider with the side effects list is that you will not necessarily receive all of these side effects. It's going to potentially occur over time. So as the weeks progress, you might notice some nausea, maybe some vomiting as the weeks further progress. The hair loss is going to be something that you experience at your site-specific area. So if you are being treated for breast cancer, you might notice that there's some loss of just like the kind of like the peach fuzz hair that people have on their skin. Or if you're being treated for head and neck and you get radiation to the throat level, a lot of people will have low level hair loss at the back of their head. But the hair loss that you experience with radiation is not the full head of hair loss that one gets with a high enough dose of chemotherapy. So the hair loss is very specific to the site that's being treated. And that's all I have for this presentation, but thank you so much for letting me chat. And if you have any questions, please feel free to ask.
Thank you so much, Elizabeth. That was wonderful. I'm sure everyone appreciates your time like I do. We did have 2 questions come in, and one was about can you have radiation in the same place twice? And I think what they mean by this is if your cancer comes back and you have to have radiation again, can you do it in the same location, say, I don't know, a year apart?
So typically, no. There is a limit to how much radiation your body can receive over a course of a lifetime, which is one of the reasons that your physicians have to be so careful with calculating your dose, because if there is the chance of recurrence down the line, it is very unlikely that they would want to retreat that same area with radiation again. The healthy tissues and healthy cells that have been affected by radiation, they will repair to an extent. But if they are re-irradiated in the future, there's a chance that they might not repair further. So we would want to make sure that we're very careful with the amount of radiation we let a certain part of your body receive. Certainly in the palliative aspect of things, if oftentimes we'll do bone met radiation for palliative patients, and we can re-irradiate bone mets, or we can re-irradiate like different parts of the body that have new mets show up. But if you have received radiation to a certain part of your body, say along the head and neck, and there's recurrence at that site, it is unlikely to receive a second round of radiation.
Okay, got you. And then the other question was about things you can do for your skin. Is there any sort of lotion or something your doctor can give you to help with any kind of skin irritations from the radiation treatment?
So one of the things that I would always advise my patients is that think of radiation kind of like when you've been laying out in the sun and had a sunburn. Hydrating your skin is going to be crucial. So before you even start your radiation treatment, think about the site of your body that's going to be radiated, and then think about getting a nice lotion that's very hydrating for that area and just already working to keep it hydrated and moist. So what we recommend specifically is Aquaphor. I do have issues with recommending that to some patients because it is texturally very similar to Vaseline, which depending on where you're putting that on your body can be very irritating to the skin in the sense of not actually irritating the skin, but texturally a lot of people don't like that thickness. So I recommend the Aquaphor healing ointment to be used at night, and during the day using something that is alcohol-free or it's free of drying alcohol. So we're looking at denatured alcohols or just pure alcohol. There's cetyl or sterile alcohol, which is not a drying alcohol. So avoid just plain alcohols in your skin, and also avoid fragrances because fragrances and perfumes are usually accompanied by a drying alcohol. Aloe vera is certainly a great option, and calendula ointment is excellent as well. We have a lot of patients who like the Aquaphor, of course, the CeraVe. We do, I can't think of the brand name, it's Aveeno, I think. A lot of patients really like that, or colloidal. And I think the component that people enjoy of Aveeno is that it has like a colloidal oatmeal extract in it, which is very soothing. But essentially, we just advise you from putting any lotions on broken skin, putting lotions on your skin that are full of fragrance and alcohol, and it is all right for you to moisturize your skin and then go receive treatment.
Wonderful, thank you. And then one last question, very similar to the skin question, is what can you do for any sort of dry mouth or sore mouth from radiation to the head and neck?
So for dry mouth, that is one of the head and neck radiation side effects that can be very long lasting. There's no evidence to support this working, but I have anecdotally had patients say that using a spoonful of coconut oil or olive oil can coat the inside of the mouth and be a little bit relieving in the time of having dry mouth. A lot of the mouth rinses and mouthwashes, they feel good when they're in your mouth, and then as soon as you gargle and spit or you swallow, you're right back to having that dry mouth feeling. I would advise, if you have very bad dry mouth, to stay away from chewing gums because it's actually going to kind of absorb saliva from your mouth and end up feeling very uncomfortable. There are certain lozenges that people can try. There's one that I think is prescription and could certainly be an option for your radiation oncologist prescribing for you. But oftentimes just like hard candy, most people keep water bottles on them. I do think that the oils are almost tonight, like a thick cooking oil can help before bed, because that's oftentimes people who have this really dry mouth, they're experiencing it the most in the morning when they wake up, or at night when they've had their mouth maybe a little open while they're breathing and they haven't drank in hours. So there isn't much in terms of a medication that's offered, so it's all just symptom management and self-limiting, but it is a tough one, the dry mouth is, for head and neck.
Okay. Well, thank you so much again for your time, and thank you to everyone who tuned in today and asked some really great questions. If you think of anything after the webinar that you would like addressed, the email address will stay open and we'll help you find the information that you need. But otherwise, thank you again for tuning in, and I hope you have a great day. Thank you, Elizabeth.
Thank you. Bye.